Welcome to Ararat Healthcare and Charcos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charcoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay your achieving your dreams any longer and sign up now.
Hi everyone, my name is Dr. Seema Balyan. I'm the director of Ararat Healthcare and Charcos Learning Centre. Welcome to my lecture series on NMC OSCE. Now in this series, I will be covering up the topics related to assessment, planning, implementation, evaluation, some of the new scenarios which have been added such as the NG tube, pressure ulcer assessment, and VIP and the intravenous flush, and also we are going to take you through the fluid balance. The aim of this series is to understand in depth that the logic behind all of the things, why we are doing, how are we doing these things, what precautions we have to take while we are doing assessment and the rest of the stations, and also the top tips. So I hope that you are going to gain out of it as much as I'm trying to put in my efforts. There are 7 episodes to this series which are going to be covering up various topics. Please do let me know if there is anything that you would like us to discuss about in future as well. And it would be great if you can subscribe on our channel and press the bell icon to get the regular updates. So I hope you will enjoy it, and thank you very much again for watching this series. Hi everyone, my name is Dr. Seema Balyan. I'm the director of Ararat Healthcare and Charcos Learning Centre. Welcome to my lecture series on NMC OSCE. Now in this series, I will be covering up the topics related to assessment, planning, implementation, evaluation, some of the new scenarios which have been added such as the NG tube, pressure ulcer assessment, and VIP and the intravenous flush, and also we are going to take you through the fluid balance. The aim of this series is to understand in depth that the logic behind all of the things, why we are doing, how are we doing these things, what precautions we have to take while we are doing assessment and the rest of the stations, and also the top tips. So I hope that you are going to gain out of it as much as I'm trying to put in my efforts. There are 7 episodes to this series which are going to be covering up various topics. Please do let me know if there is anything that you would like us to discuss about in future as well. And it would be great if you can subscribe on our channel and press the bell icon to get the regular updates. So I hope you will enjoy it, and thank you very much again for watching this series.
Escalation. Okay, so next one, Harsha, do you want to tell me the next one?
Yes, ma'am. Next patient is Dan Brown. I got total null score is 3 and monitoring frequency was 4 to 6 hourly. Escalation of care, yes, we need to escalate the care.
Okay, so how did you get the score of 3?
Respiration was 23. It will fall in orange color, so the score is 2. Then oxygen 98. It will white. The score is 0. Then BP is 110/70. So it will come in yellow color. So score is 1.
Okay.
Then pulse gate, it will come in a white color. So score is 0. Then again temperature 37. It will fall in white color. Again score is 0. Total score is 3.
Okay. Everyone agrees with that one?
I know is the respiration is 23, so it's 2. So how
Yeah.
come the other one, the 1?
So if you will check in the, if you open up your news chart and if you see the blood pressure, which is 110/70, so 110 will fall in the yellow one.
Yellow,
So
okay.
one comes from there.
All right, thank you.
Yeah. Okay, that's good. So what is the monitoring frequency again, Harsha?
It's a 4 to 6 hourly.
Yes.
So,
and are you going to escalate it?
Yes, ma'am.
Okay. Okay, that's great. So the next one, Bonnie, do you want to try the next one?
Oh, hold on a second, let me get it. I lost it. Yeah. Next one is Disha respiration
Disha Patel?
17. Yeah, it's normal.
Yeah.
Saturation is normal. 119 blood pressure on 78 is normal. Pulse is 100. I'm not sure about that.
So check
If I
now check in the open the news chart. It is
I'll
there
do
in
both.
your
It's 110. That might be 1. That's 1. The other one is temperature is 38.1. So that will be 1, isn't it? No.
Yeah.
Yeah, that will be 1 is 2. Is it right?
Yeah, so over here, if you will see, temperature is 38.1.
Yeah,
so
it's
it is
1.
in yellow. So it is
Yeah,
going to be
yellow
1.
1. So
Yeah.
its news is 2.
Okay. And what is going to be the monitoring frequency?
New, if it is new, is 4 to 6 hourly.
Okay. 4 to
Is that
6
right?
hourly.
Yeah, 4 to
that is
6
fine.
hourly. Yeah, you need to inform the in charge or the doctor
Yeah,
because
so
of the
you
temperature.
Yeah, it is better that you are going to escalate it. Now,
Yes.
because of the temperature, it is possible that the pulse is high as well. But the temperature is high, then still we will need to make sure that what is going on. Yeah.
Yeah.
Okay. So the next one, Nivya, are you okay to do the next one?
Next one is Harry Williamson, and respiratory rate is 25. For that, I give 3, and oxygen saturation is 94, and again it's 1.
Okay.
BP is 112/72. It's normal 0, and pulse rate is 55 0. Temperature 36.1 0. And according to AVPU, it is confused, and it is 3. The score is 7.
Okay.
And I calculate it, and the monitoring frequency is minimum 1 hourly.
With the score of 7, is the monitoring frequency 1 hourly?
Sorry, ma'am. It's continuous monitoring.
Continuous monitoring. Yeah. So you can see that this patient is obviously very, very sick. Respiratory rate goes 25, which is in 3. So just by just the respiratory rate, 3 alone will make it that hourly anyway you will have to do it, because single parameter in 2 hourly monitoring. But then he is confused as well. So confusion gives him another 3. Yeah, and his pulse is quite low. Oxygen saturations are also low. So there is quite a lot going on. So it is going to be continuous monitoring for him. Yeah, everyone agrees with that one?
Yes.
Okay, great.
Yes, ma'am.
Okay, so Jinsi, next one coming to you.
Yes, ma'am.
Yeah, so Sadie Armstrong.
Okay, ma'am. Patient name Sadie Armstrong. Respiratory rate is 18, so I gave 0. Oxygen saturation 98, so I gave 0. BP 140/90, so I gave 0. Pulse is 86, so I gave 0. And temperature is 36.4, I gave 0 score. And AVP is alert, so I gave 0. The new score is 0. And the monitoring frequency is every 12 hourly, and there is no need of escalation of care.
Great, well done. So I think that all of the scenarios, everyone got the same sort of score. Did anyone get anything different? No? Okay, so
No,
I'm
ma'am,
sure
it's
that, okay, so I'm sure that by these ones, now you will be able to, or you will be confident in completing the news chart.
Yeah.
Yeah, and you understand the logic behind that, why we are doing what is the monitoring frequency, whether we need to escalate or not escalate. So I'm sure that all of you would have understood. Now, as I had already told you, that now it is going to be a live patient is going to be. So it's not going to be that you will just get the flashcard and you are going to be able to fill it. So earlier they would give you flashcards similar to the one that I had given you, and you would look at the flashcard and you were required to complete the chart. But it doesn't matter. As you are going to keep on doing your reading, you will be noting it down on a piece of paper, so that becomes like kind of your flashcard. So you will have all of the readings, and you are able to then transfer them into your news chart. If you want, you can directly write it in your news chart as well. So whichever way you feel comfortable, you can do that. Okay. So the GCS ones that I had given you, now, did anyone have any difficulty in doing the GCS one? Now, I know that there is no score that I can sort of really discuss, but did anyone have any difficulty in completing that one? Or confusion in that one?
no, ma'am, no confusions are there.
Okay, so if I think that what you can do is that I will not ask any one of you to sort of share it with me, because it is going to be so many that there is no point in sharing. So if anyone is having any confusion in that one, if not now, then you can tell me later on as well. But again, that is pretty straightforward that you are going to be getting. There is no calculation of a new score that you will require to do in this one, because again, you are calculating the GCS. So there is whenever a patient is having a GCS monitoring that you are doing, anyway, you will need to record his reading every 30 minutes for the next 4 hours, or till the patient has got his GCS 15 and they are stable at a GCS of 15. After that, once you know that they have achieved the GCS of 15 and they are stable on that, after that you can turn to the news chart. And when they go to the news chart, then you are going to do according to the news chart or the news scoring that you are going to get. But while you are monitoring their GCS, at that time you are anyway going to do their observations every 30 minutes. So that is the reason that we do not need to really calculate the score or give the monitoring frequency in the GCS.
Ma'am, excuse me.
Yes, Sachin.
Okay,
Yes.
so in the third flashcard, that is the GCS flashcards, about Dan Brown, the pupils are written as eyes closed, but in the GCS, it's written is spontaneous. So how is that possible?
Yeah, good catch, huh? Yeah, probably I just overlooked that one. So yeah, there would be even in the GCS, it is going to come as eyes closed. So you cannot calculate the GCS from that one, the eyes section.
Okay, so we have to write C over there, right?
Over there as well, yeah.
Okay, thank you.
Yeah. Okay. Anything else?
Ma'am, for the last scenario, Disha
Yeah.
Patel.
Yeah.
Lower and upper and lower extremities, mild weakness, it's written, no ma'am. So in the same column, how to mark it?
So you will write L and R in the same column. Yeah, so you are only going to write L and R. So we will have one session where we will be doing all the charts, and in that I will be showing you completing a chart, and I'll show you that how you are going to be writing it. But basically you have to write in the same column, you will have to write L and R.
Okay, fine.
So if anything, like if you will see in the same patient, in the upper limbs, if you are seeing that R is mild weakness and L is severe weakness, then against the mild weakness you will write R, and against the severe weakness you will write L. But if both of them are normal, then you are going to write L and R in the same column or in the same square. Okay. Fine. So I think that with the GCS and the news, I think that you guys are all okay. Yeah. So if we quickly go on to the other two scenarios, which we were not able to do on that day, that is the MUST and the PHQ9. Now in the MUST and PHQ9, so who is going to do the introductory 6? Let me just share the screen. Let me bring that one up, and then we can, one of you can do the introductory 6. Okay, so we are going to the MUST scenario. Yeah, so if we look, so this is the so all of you, do I need to revise the MUST sort of thing that day, what we had discussed? Maybe I will do. Yeah, I'll quickly sort of take you through that, what exactly is the MUST assessment. Now in the MUST and PHQ9, in both of the assessment, you will require to complete a chart, which is which is your TPR chart. Now TPR chart is just that is where you are calculating only the temperature, blood pressure, pulse and respiratory rate. So you are not required to do any oxygen saturations, and the alert, confusion or calculating of the score, you are not required to do any of those things, because remember, the patient is in the community. If the patient is in the community, we are going to assume that his breathing is all right, his he is not required a continuous monitoring, or he is not required a regular interval monitoring, and that is the reason that we are not going to be calculating any other things. Okay, so but since the patient is in the community, now we have to do the assessment of the things which can be a long-term problem for the patient. Now when we talk about long-term problem, MUST is the malnourishment assessment score that you are, it is a tool in which you check that whether the patient is malnourished. Now malnourishment is something which is a chronic problem, it is not an acute problem. And that is the reason that you do the assessment of MUST in a community scenario majority of the time. Yeah, sometime you do that in the hospital as well, but you will be doing that in the hospital. Patient is there for a long time. Okay. Then for the PHQ9 as well. Now PHQ9 is also a long-term or a chronic problem, because it is a depression scoring that you are doing. And that is the reason, again, it is not an acute thing that you are going to be doing, and you can do it in the community. So these are the two scenarios which we are going to be doing. Now in both of the scenarios, majority of the scoring and the reading is already done, but since till now you were getting only 12 minutes, that is probably the reason that all of the scoring, like the BMI or the percentage of weight loss, that was already calculated for you. But now, since the time interval is going to increase back to 15 minutes, it is quite likely that you will need to calculate the BMI of the patient, and you will need to calculate the percentage of weight loss, and you are going to be also assessing the acute disease effect. Now, if you will see, first we are going to do the MUST assessment. Now, if you will see in the MUST chart, can everyone see this MUST chart?
Yes.
Yeah. So if you see in that, you will see that there are 3 steps to reach a must scoring, and hence decide that whether the patient has a low risk, medium risk, or high risk of malnourishment. Okay. Now you will be given some details of the patient, like the name, date of birth, medical record. These are anyway, they are going to be there, but you will get height and weight of the patient, and you are also going to get the previous weight of the patient as well, from which you have to calculate the weight loss. Everyone understood that one?
Yes, ma'am.
Yeah. So if you will see the step 1, yeah, in step 1 you will need to calculate the BMI of the patient. Now, can anyone tell me how do you calculate the BMI?
Weight divided by height into meters square. Weight in kilogram divided by height.
Okay, yeah, it is correct. So it is the weight in kilograms divided by height in meter square. So if you get a height in centimeters, say if I say the patient is 162 centimeters, what is going to be the meters if you convert it into meter?
It will be 1.62 meter, ma'am.
Yes.
1.62.
Yeah, so all you will have to do is that to convert anything from centimeters to meters is that you will need to put a dot, leaving 2 things on that side. So 162, so you are going to leave 162, so you are going to 26, and you are going to put a dot over there, because in 1 meter there are how many centimeters?
100.
There are 100 centimeters in 1 meter, so you just divide it by 100, and anything that you divide by 100, you just bring the decimal on your left side of the column. So you are just going to, it's easy peasy, so you just put it over there. But I would also suggest, although see in the exam you are not going to get any difficult situation, but it might also be a good idea that you should know how to convert it from the feet and inches, because sometimes you can get the height in like 5'4" Yeah, so you should be able to calculate it into centimeters and then into meter square or into meters. Yeah. So today anyway, I will be sharing quite a few of these scenarios just for must calculation. Okay, so you can get the practice of how to calculate the must scoring. Okay, so now let us go back to it, that we will be this is how the first thing that we are going to be checking is going to be the BMI. Now BMI, if you will see, if the patient's BMI is over 20, yeah, then the score is going to be in the green, so the score is going to be 0, because over 20 the patient is not at risk of malnourishment. Yeah. Malnourishment is when patient is undernourished. So the score, if it is 18.5 to 20, it is going to be in orange, and you are going to give a score of 1. And if it is less than 18.5, then you are going to give a score of 2. So you are going to be calculating and you are going to be marking the score according to what BMI you have got. Okay, so that is going to be your first calculation that you will do. Second calculation is the percentage of weight loss. Now, in the percentage of weight loss, you have to just calculate the percentage, not to the exact point, but you have to calculate the range. You have to see that whether the percentage of weight loss is less than 5%, between 5 to 10%, and that whether it is more than 10%. Okay. So you will be given a calculator as well for this one. So you can use a calculator to calculate the percentage of weight loss. But you can find your own easy ways as well, that how do you calculate the percentage of weight loss. Okay. So again, today's scenarios that I will be giving you, you can practice that one. Once you are coming for face-to-face, then we can discuss a little bit more, and we can try some more easy ways of calculating the percentage of weight loss as well. Yeah? So if we take, say for example, if we are taking one scenario that the patient weight was 82 kgs, the previous weight was 82 kgs, and the current weight is 76. Can you tell me what is the percentage of weight loss?
7.3.
Okay. So you have calculated it, and it has come between 5 to 10%. Yeah. 7.3 is the between 7
to 10.
between 5 to 10%. So how did you calculate it?
Weight into x by 100 is equal to the weight loss. So find the value of x, and that is the weight loss.
Okay, which is fine. If you want to go for accurate, then definitely that is the formula that you will have to try. But since we are just trying the range, so maybe one of the easy way that I think or I try and calculate is that you know that it is previous weight was 8.82. Yeah, so 10% of 82 is that you just have to put a dot in between. It is 8.2. Yeah, how much has he lost? He's lost, it is current weight is 76, so he has lost 6 kgs. 6 kgs. So I know that 8.2 is 10, so 4.1 is going to be 5%, and he has lost 6%. So or 6 kgs. So I know that it is going to be between 4.1 and 8.2. So it is between 5 to 10% of weight loss. Did you get it? Sachin, did you understand that, or anyone understood that?
Yes, ma'am. Understood.
Okay. Okay, but see, the idea is to calculate the percentage of weight loss. Whichever way you want, you feel comfortable, you can do that way. So there is no right or wrong way. You will get a calculator, so you can calculate it. Okay. Agu, do you want to ask something?
Ma'am, can you please once more explain the calculation? I didn't get it properly.
Okay. So what I'm trying to say is that, see, 82 was the previous weight. Yeah. So whatever he has lost,
Okay, ma'am.
he has lost from 82, isn't it?
Okay.
Yeah. So we are calculating the percentage of weight loss. Now, percentage of weight loss can only be calculated from a previous weight, that from where he has lost it. Okay. So that is the reason that if we know what is 10% of the previous weight, then we know that we can calculate 5% as well. If we know 10% of anything, half of that is going to be 10%, 5%, isn't it?
Yeah, okay.
So 82 was the previous weight. I know that if I put a dot in between, then that is the 10% of anything. Yeah. So to make out 10%, all I have to do is to put a dot in between.
Yeah, okay.
Yeah. So it will become 8.2 is my 10%. So my 5% is going to be 4.1, half of 8.2.
Okay.
Yeah. Yes, so I know 5%, I know 10%. So now I have to see what is my total weight loss. I know that his weight previously was 82, now it is 76. So he has lost 6 kgs. So it is falling between 4.1 and 8.2. So I know that the percentage of weight loss is between 5 to 10%.
5 to 10%.
Yeah,
okay,
so
ma'am, thank you.
You don't need to use the calculator for this one, but as I said that there is absolutely fine to use the calculator. So you don't have to try this one if you feel comfortable in the other sort of thing. Okay. So once you have, so that was the second thing, so that you calculate the percentage of weight loss. Yeah. Then when you, so you have got 2 parameters already. Then you come to the third one. Now the third one, I want you to have a look at it properly. So this can sometimes be a little bit confusing. So it says that acute disease effect score. Okay. Now what exactly, and under it, if you just read it in something which is written in red, it says that if the person is acutely ill and there have been likely to be or no nutritional intake for more than 5 days. Now, in this one, because it is going to always be like a, you are going to get it like a community scenario. You can say, okay, 99.9% must is going to come as a community scenario. Now, if the patient is in the community, that person cannot be acutely ill. Can he be acutely ill? He or she? No?
No.
So this, the step 3 automatically becomes not applicable. Yeah, it is automatically, the score is going to be 0 because the patient is not acutely ill to start with. And second thing is that, is there anyone in the community who can be nil by mouth or without no nutritional intake for more than 5 days? Can you be in the community?
No.
That for 5 days
ma'am.
you have not eaten anything? It is not possible. You will be, after a day or two anyway, you will end up in the hospital. Yeah, if you have not eaten anything for that long. Yeah. So both of these things suggest that this is not something that you will be doing for anyone who is in the community. Now tell me that a couple of scenarios in which you think that any of this can be when the patient is in the community. Can you think of any scenario when the patient is in the community, but still something like this is happening?
Negligence, or sometimes because of isolated elderly people.
Yeah, but then those are not going to be like, they will be acutely ill if it happens. If they are not eating anything for the last 5 days, when you will go and see them, even when they are isolated, you will not find them conscious, or you are going to find them in an acutely ill state. Yeah. So it is hardly any conditions, except sometime you can think that, okay, there might be a patient who is in coma, who have been sent home. But when the patient is in coma, they are still acutely ill. So you can't really say that, okay, they are stable and they are fine and that's why they are there. But they are still getting, the nutritional intake is still happening. Yeah, they are being either peg fed, or they are being like an IV cannula or something. So they are getting some kind of a nutrition still, it will be going. So essentially, if you will see that in the hospital, or sorry, in the community, it is almost always, it is going to be a score of 0. Yeah. But in the hospital, can you tell me that if the patient is in the hospital, can you tell me a few scenarios that when you will be giving this score?
When they are nil by mouth, or when they have NG feed.
So
or
nil by
peg
mouth
feed.
for 5 days. So which are the conditions where you would think that they will be nil by mouth for 5 days?
Any obstructions or anything like that.
Yeah, so anything which is like a cancerous or any obstruction in your food pipe. So those are going to be the patient.
If they have any swallowing difficulty.
Yeah, if they are having any swallowing difficulty. Or if patient is having a massive abdominal surgery that they can't take from mouth. Yeah. So in the hospital, you can think of quite a few scenarios where you will be scoring for this thing. But in the community, it is always going to be a score of 0 that you will be giving. Okay. So do not get confused in this one, because sometimes the examiners, they will try and say that, oh, I have not been eating anything. I'm feeling very weak. I'm feeling very tired, and I have not had much to eat. So they will try and sort of confuse you a little bit, but stick to your thing that, okay, if they are eating anything, then definitely they are not going, you are not going to be scoring in this one. Okay. So any questions anyone has in the must calculation? No? Okay. So once we have got the score, say for example, this patient had a weight loss between 5 to 10%, but his BMI is normal and acute disease effect score is 0. So my score comes as 1. Yeah. So then I'm going to be, so 1 means that my patient is in the medium risk. Yeah, so you will need to put a total must score over there. You are going to circle the medium risk. You are going to put the date, time, and signature, and then you are going to be explaining to the patient that what exactly does medium risk mean, what are you going to do now, and what should the patient expect. So if there is someone who is in the medium risk, what do you think that you, what advice would you be giving? So I had shared if you look in the group, I had shared a key as well for the must malnourishment universal screening tool key. So how to calculate, and there was what advice to be given in low, medium, and high risk.
Yeah.
Yeah. So can you tell me that what advice are you going to be giving in someone who is in medium risk?
Observe the patient, document the dietary intake for the 3 days, for the adequate intake. If it is inadequate, you need to follow, like refer to the dietitian.
Yeah. Yeah, so when you are telling to the patient, so this is something which is, so this key will be given to you in the exam. So you, again, you do not need to memorize this one, but you have to understand this one, that, okay, why you are doing and what you will be doing. Now, when you are telling, when you explain it to the patient, so in that, we will need to explain it in such a way that the patient is able to understand it, and you are able to formulate a kind of a plan for the patient. Yeah. So we can tell the patient, like the first advice which is given, document dietary intake for 3 days. So rather than telling this to the patient, what we would tell is that, okay, Mr. So-and-so, I think that in order to make us see that how much you are eating and whether you are eating a nutritious diet or not, I think that it will be a good idea for us to keep a record of what you are eating. So make like a dietary chart. Yeah, so you can say that, okay, this is a book in which all you can note down what you are eating in the whole 24 hours, and carry on recording it for the next few days. So when I will come back to see you, then we can go through this diary and we can see that whether how much you have eaten and whether that was a nutritious diet or not. Yeah, so that the way that you are telling, patient knows what they have to do and they are able to understand it in the simple terms. Yeah. So then it is written that if adequate, little concerns and repeat screening. Hospital, if the patient is in the hospital, then you will do a weekly screening. If the patient is in care home, you do monthly. In the community, at least every 2 to 3 months. Yeah. So what you are going to tell the patient is that I will see you again in 3-4 days time, and then we will go through the dietary the chart, and if we feel that you are taking enough diet and it is nutritious diet, then we can carry on monitoring that one, and I'll see you again in a couple of weeks time, or we can review or reassess it in a monthly basis. Yeah, but if it is inadequate, yeah, then you will have to see that, okay, if it feels as if that you are not eating very well, or you are eating not eating like a balanced diet, then I will make some suggestions and we can go through those suggestions, that how we can improve your dietary intake. Did everyone understand that?
Yes, ma'am.
Yeah. So this is, see, when you are doing these kind of scenarios, I would suggest that it will be a great idea if you can put in your mind that you are dealing with your grandmother or some elderly patient who you are trying to explain these things. Yeah, so you need to say it in their language, and how, or they should be able to understand that what are you going to be doing, and it should be very clear. Okay, so apart from this one, so you have given them this, okay, in our advice that we are giving, we are saying that we are going to keep a dietary intakes or a diet chart, input, output, whatever patient is eating. we are going to make sure that they are eating a balanced diet. Apart from that, what else can you do which is going to tell you that whether the patient is eating or not eating? Because see, sometimes what happens is that maybe I am someone who is smart enough and who don't want the nurse to nag me, and that's why I have written down everything, but I have actually not eaten them. So what else can you do to figure out or find out that whatever is written over there, or whether things are moving in the right direction or not?
Monitor the weight.
Monitoring weight.
Absolutely. So you can monitor the weight of the patient. Now, if I am eating healthy and if I'm eating regularly, it is definitely going to have an effect on my weight as well. Yeah. So how often you should be doing the weight check of the patient?
In hospital, it's weekly.
Yeah, so weight check, I would suggest that even in the community, at least to start with, we can check the weight every week or whenever you are visiting the patient. Because if there is no point in checking the weight after a month and then realize that actually patient has been losing weight, because in that 1 month, then patient has lost another 2-3 kgs, you were not able to pick it up, you are not able to do anything. But if you do it on a weekly basis, then at least if you see that patient's weight is going down steadily, then at least there is some step that you can take before a month. Okay, so this is something that we would be doing, the weight. So first is dietary chart, second is weight. What else can tell us that whether it is the input output and whatever patient is eating is going according to the plan or not?
Family members can be involved in the care.
Okay, so that will be the fourth thing. What is the third thing? So the third thing could be your bowel patterns, isn't it? If you are not eating very well, you will end up either constipated, or you are not going to the toilet on a regular basis. Or if you are not eating high roughage or high fiber diet, then also you will get constipated. So your bowel movements can also give you an idea that what exactly is happening. If you are dehydrated, you are not going to be going to pass urine, even the stools, you will end up getting very constipated or hard stools. So that is another thing which is going to tell that whether the patient is having enough and whether they are having it on a regular basis or not. So a healthy bowel habits tells you that the system is working correctly and that you are eating well. Okay, so then you can go into that. Okay, you can involve the family members, that they can give you some indication, they can encourage the patient, so you can do all those things as well. So now, have all of you understood that what kind of an advice to give to the patient? Any questions so far? Okay, if there is no questions, then that is the must scenario for you. Now, I want one of you, I'll do the Phq9 as well. Then one of you, I want you to just go through the introductory 6, and we are going to do till taking the observations. Okay. So the next one, I'm going to tell you about the Phq9. Now, has anyone previously seen or done Phq9 scoring, or have you heard about it?
Yes. Yes, ma'am.
Yeah. So, it is basically a patient health questionnaire. Yeah, that is the full form of PHQ. And because there are 9 questions, that is the reason it is called as Phq9. Now in my screen, if you will see, it is by mistake, it is 111 on all of them, but it is actually 9 questions that you are having. Okay. So these 9 questions, you ask them. So this is basically a tool which we use to give us an indication that whether the patient is having depression or not. Now, depending upon the score, we can classify it into a minimal symptoms that patient is having, or minor depressions, or major depressions, or major depressions with the the severity, that it is a moderately severe or it is very severe. That is going to give us some indication that what the patient's mood have been lately. Okay. And for that one, if you will see the questions which are asked, we ask the patient that you have to think whether you are feeling like this over the last 2 weeks. So it is not like today's feeling that I'm telling. I will be thinking in the last 2 weeks that if, for example, if you take the first question, little interest or pleasure in doing things. So I will be asking the patient to tell me that over the last 2 weeks, have you had little interest or pleasure in doing things? Now, if the patient says that yes, then it becomes that, okay, whether it has been several days or more than half of the days in the 2 weeks or nearly every day that you have been feeling like that. And depending upon that, the patient is going to mark the circle. Okay. So in your exam, you will already be, this score would already be done for you. So you will not require to actually ask these questions to the patient and calculate the score. So it is going to be marked the way that it is marked in my screen. If you will see that either they will be circled or underlined or ticked on those things, but it will be marked over there. So sometime they do the calculation as well, that they will give you a total score calculation. Sometime they just leave it like that and then you will have to calculate it. Okay, so for this patient, can anyone tell me that what is the, Anju, can you tell me that what is the total score?
11.
Yeah, so the total score is 11. Now, if you will see on the left side of the same sheet, there is a key. So that key tells you that if the score is between 10 to 11, that what is happening, what is the provisional diagnosis and what is the treatment recommendation. So can you tell me that with a score of 11, what are you going to diagnose and what are you going to recommend?
Yeah, diagnosis, the patient have minor depression or dysthymia or major depression mild. And the treatment recommendations is mainly we have to give the support and watchful waiting. Then we go for antidepressant or psychotherapy. These are the things, ma'am.
Okay. So basically what we are trying to say is that, see, when we are saying about 10 to 14, and it has divided it into 3 parts, which is minor depression, dysthymia, and major depression. So probably we will be taking like 10 to 11 is going to be like minor depression. If it is somewhere around 13 or so, then we can say that, okay, dysthymia or going towards the major depression. And if it is 14, then we are going to say that it is a major depression that you have got. Yeah. So when we are giving an advice, so we have decided that we will say to the patient that, okay, your total score has come back as 11. And according to that, you seems to be suffering with minor depression. Now, the advice over there is support and watchful waiting. When we say support, what do you mean by support? What kind of a support are you going to be giving?
Psychological support.
When we say psychological support, then what does that mean? What exactly are you going to do? I can't just tell the patient that, okay, I will be supporting you, but supporting in what ways?
Involving with like some groups or some activities, or involving the family members, ask them to stay with the patient for most of the days, or we can go and spend some time with them.
Okay.
We can help them to ventilate their feelings.
Yeah.
Okay. Then that's the way we can find out what thing is mainly worrying them, helping them to ventilate their feelings mainly.
Absolutely. So I think before we can start making corrections, we first need to know what is wrong. Yeah. So before we tell the patient that, okay, we are going to support them in that way, probably we need to find out a little bit that why is the patient feeling like that? It is in the history, it is possible that it will be already be given to you that this patient is someone who lives alone. Yeah, or they have lost a family member, or maybe he had been in the hospital for quite a long time, or he's suffering with this chronic illness, or he used to be able to walk on his own, but now he is confined to the chair. So we need to figure out that what is the problem, why are they feeling the way that they are feeling. And once we know that, okay, this is the reason, then we can start saying to the patient that, okay, I can understand that you have been living alone, and sometimes that can make you feel a bit lonely and low in your mood. So if, say, for example, if the patient is in a care home, then you can say that I'll show you around the care home. There are a lot of activities that you can do over here. We have a book club which runs over here. There is a common room where you can go and watch telly, you can talk to other people, you can make friends. So you are going to be giving that advice to the patient to say that, okay, these are the things which are there, which I'm going to be involving you in those things. Yeah. And then we are also going to tell that I know that it is possible it will be difficult to start with, but maybe you can start with the activity that you love the most. Do you have any hobbies? Like if the patient has a hobby of reading, then maybe you can say that, okay, there is a reading room that you can go. You can get the books and start reading, and maybe we can discuss, we can have a common book and you can discuss it with some other people. And so you are giving the patient some idea that how they can come out of their shell, how they can make sure that they are not feeling lonely, how can they be engaged. And then you are going to tell them that, okay, anyway, I will be coming and seeing you again in a week's time, and then we'll see that how you are getting along. Yeah. So you have given all these advice to the patient. Now the patient will ask that, okay, so are you going to check this thing again? How will I know that I'm getting better? How will you know that the patient is getting better?
More cheerful or more engaged.
So you can make it out by just sheer observation, that the next time you go to see the patient and you see that the patient is actually feeling much happier, his mood is looking much better, he is talking more, so he is engaging more. So just by observations you can make out, but that is going to be like a subjective criteria. What is going to be the objective criteria? How can you definitely say that yes, patient is definitely better? What told you that patient was not good?
We need to reassess the Phq9
so
after 2 weeks.
You need to understand that whatever tool tells you that patient is not well, the same tool can tell you when the patient is getting better. Yeah. So if Phq9 has told you that the patient is in minor depression, you can use the Phq9 again to figure out that now patient is falling into the minimal symptom criteria. Yeah. So that becomes your objective criteria. Yeah. So you will need to repeat the Phq9. But now tell me that how soon will you repeat the Phq9?
After 2 weeks.
Monthly.
Do you think 2 weeks is enough?
Every month.
For someone to get out of depression and to feel better, do you think 2 weeks is an enough time?
No.
Yeah. So I would suggest that the Phq9, although definitely you can't repeat it within 2 weeks time, that is for sure. You cannot repeat it before 2 weeks. But I think it is always advisable to repeat it in about a month's time. Because see, if the patient was in major depression, and if you are starting the patient on some counseling or some medication, yeah, all of the antidepressants, they take around a month to sort of start showing their effect. Yeah. So you do not want to repeat the Phq9 too early, because say for example, if you repeat the Phq9 in 2 weeks time and patient has not got any better, it is going to give a wrong impression on the patient, and the patient will get even more depressed, saying that, oh, nothing has changed. I have been trying to do things and nothing has changed. My score is still the same. Yeah, and they will get discouraged and not use the advice which you had already given them. So there is always a risk that that might happen. Did you understand?
Yes, ma'am.
So this is basically about the Phq9, that how you are going to assess the patient and what kind of an advice you are going to give the patient. Yeah. So when we are not just going to read out that, okay, we are going to give you support and watchful waiting, we are actually going to tell that what support, that what we are going to do, and when are we going to reassess you. You are going to give some line of sight to the patient. Okay. Now, all these things which I have discussed in both MUST and PHQ, these will form a very good basis of my next sort of thing that we were going to discuss about the care plan. Because all these things are the things which you will be writing actually in your care plan. Okay. But before we go to the care plan, I want, who is going to take today, who did not do it on Saturday. So this is my patient, and we want to do till the TPR, or we want to do his temperature, pulse, blood pressure, and all those things. Introductory 6, and yeah.
I haven't done on Saturday.
I haven't done.
Agu, you want to do it?
Yeah.
Okay, go for it then. So you have got all of the information that you require in this screen. So I'll be your patient. Yeah, so you can start by entering the room and doing your introductory 6 and going ahead. And then you will need to tell me all how you are going to do the blood pressure, temperature, pulse, and all those things.
Okay, ma'am.
Okay, go for it then.
Okay. I enter the room. I provide privacy by closing the windows and the curtain, and check for safety. I check for the ground. There is no water spillage. There is no wires. So the environment is safe for me and my patient. And I do hand hygiene, palm to palm, palm to dozen, fingers interlace, fingers interlock, rotation of the thumb, tip to the finger, and my wrist. My hands are clean, and I assume, and I allow it to dry for 30 seconds. I approach my patient. Hello, good morning.
Good morning.
My name is Agu Augustina. I am the one of the nurses taking care of you this morning. Please.
Okay.
May I know your name and your date of birth?
Okay, my name is Henry Williams, and my date of birth is 1st of January 1960.
Okay, please, Henry Williams, how do you prefer me to call you?
You can call me Henry.
Okay. Henry, please, can I cross-check your wristband to confirm from what I have in my charts?
Okay, go ahead.
Okay, your name is Henry Williams. Your date of birth, I've forgotten the date of birth.
It's fine. It's 1st of January 1960. Yeah.
Okay. And your hospital number is 12345HH. And my assessor, I can confirm that I am with the right patient, so I'm happy to proceed with this assessment. And Henry, please, do you have any allergy to the drugs, food, or latex?
No, I'm not allergic to anything.
Okay, I can confirm from your wristband, you are wearing white wristband, that you don't have any allergy. Okay, Henry, please, I want to carry out an assessment on you. Please, I want to know, are you comfortable for me to start?
Yeah, of course you can.
Are you any pains?
Sorry?
Are you in pains?
No, I'm not in any pain.
Okay. Do you need to use the washroom? Proceed?
No, I don't need to use the washroom. I'm fine.
Okay, okay. My assessor, I can confirm that my patient is comfortable and that the legs are not crossed. So, what you do, I can assessment your temperature, your pulse, blood pressure, and I will start with blood pressure. So, my trolley and my assessor can confirm that the trolley is within the 25. My blood pressure apparatus is calibrated and moved on to the zero. So I'll push it to the patient beside. I will do another hand hygiene, palm to palm to dozen, fingers interlaced, fingers interlocked, fingers interlocked, rotation of the thumb, twist to the finger, twist to the finger, and my wrist and my hands are clean. So I can approach my patient. So Henry, please, I want to tie this BP apparatus, and if I start it, you will feel a little tightness. And don't worry, you might be uncomfortable, but it's okay. That is how BP is being checked. And I will choose the right cuff for you. I tie it 2 to 3 times above anterior cubical fossa. So I tie my BP apparatus and got my BP. And I will check for the finger. Please, Henry, please, can I check your finger? I want to use one of your fingers to do pulse oximeter. So,
okay.
So I check for the papillary return. I press it at the level and I check on it. And the skin is not cold and clammy, so I decided to use. So I now check, I know. And I check the SpO2. So, and Henry, I want to check your pulse, and it will take me 2 minutes to check your pulse. Please, I would like you to complete so that we can get the correct results. So I checked my pulse, and Henry, I checked your pulse with 1 minute. And I use it for the respiration. I didn't tell you about the respiration so that the results will not be altered. And again, please, Henry, please, my assessor, I forgot to check the hands to ask Henry if he had any surgery in the past lately, and if there is any bruises or cannula, and I confirm there is no bruises and there is no cannula at the hand that I used. And Henry, please, I want to check your temperature, and I will use tympanic temperature. Please, do you prefer any ear for me to use?
No, that is fine. Any ear would be fine.
Okay. Are you using any hearing aid?
No.
Okay. So I checked the right ear. I can confirm that there is no discharge and there is no bruises in the right ear. So it's right for me to use. So you will hear beep. So if you hear it, just relax. It's how the temperature is being checked. So I check the temperature and I'm done with the assessment. So I do my hand hygiene again, palm to dozen, fingers interlaced, fingers interlocked, rotation of the thumb, twist to the finger, and my wrist and my hands are clean. So I document my TPR and my BP. And Henry, there is another questions that I would like us to discuss about your nutrition, and it's called Malnutrition Universal Screening Test. Are you uncomfortable for me to proceed?
Okay.
Okay. So, okay, I've done the test on you, and I've checked that the BMI, your height is 1.7 cm and your weight 74 kg.
Yeah, I have lost a little bit of weight.
Yeah, from your file, I can see that you are also diabetic, and you are discharged from the hospital. Okay, sorry, you are the Harry is in a care home. Okay, so and you lost quite some weight. Don't worry, don't worry that we will if you cooperate with us, within 1 month you will gain some weight. So, and I would like you to adhere to our instructions so that if you work with us, that you will be fine. And I can see from your chart that your BMI is 25 and the BMI score is 0, and the weight loss is 6 kg, and your weight loss score is 1, and you are not in your acute disease score is 0, so your MOS score is 1, and 4 of 1 used to call it medium risk. So, Henry, do you mind if I ask you questions?
Sorry, say again.
Do you mind if I ask you some personal, personal questions? Okay. Now that you are in care home, we will make sure that we will take care of your feeding and your assist you in the blood sugar check and every other thing. But another one is how do you eat? Do you normally finish your food or half of it, or you don't like eating at all?
No, I have not been eating very much.
Okay.
I didn't like the food in the hospital.
Okay. So now that you are here, we will make sure that we will be serving you your food preferences based on your diagnosis, so that we will not increase the blood sugar or make it to be low. And secondly, how did you empty your bowel?
Yeah, it is fine. I do suffer with constipation occasionally.
Okay, that's because you are not eating well. But from now on, we'll be monitoring your food and make sure that if you start eating well, your bowel movement will be well. And again, Henry, do you like drinking water or fluid?
Yeah, I do drink, but probably I could drink a little bit more.
Okay, I will encourage you also to be drinking water a lot, so that it will help you in to rehydrate you, and secondly, it help you with the bowel movement. And okay.
Also, while you are over here, we will check your weight as well every week.
Okay, Henry. Secondly, we'll be checking your weight weekly to monitor your. We'll be checking your weight weekly to monitor your improvement in feeding. And if your weight improves, fine. But if your weight did not improve, we involve a dietitian that will come and assist, that will come and help you and prescribe some food that will suit your diagnosis, so that your weight will improve. Are you okay with that?
Yeah, absolutely.
Okay. Henry, please, if I ask, do you smoke?
No, I don't.
Okay. Well, do you drink alcohol?
No, I don't drink alcohol either.
Okay, that's good. So, my assessment, I'm done.
that was not bad at all. That was good. But I think by end you were just fed up of it, that okay, I'm done now.
Honestly.
So who is going to, Vrinda, can you tell me that how are you going to close this station? What are you going to say? Vrinda, can you do that?
Yeah. Yes, ma'am. Okay, at last, okay, Mr. Harry, sorry,
Henry.
I'm already, okay, Henry, I'm already done with your assessment, and your assessment findings are your new scores are normal, so no need to escalate to the next session. Then your GCS scores are normal.
So we are not doing news or GCS. It is a community scenario, so we are not going to mention those ones. Yeah.
Okay, and in your mass scores, I think it is normal, and you need to follow a planned diet for your health. And
so basically, when we are doing the closure of the station, we would say that after from where Agu left, that okay, you have given him the advice So you can say that, okay, Henry, I have given you all the advice, and now I'll make sure that I just record all of these things in your notes. So I will update your notes. And since I have told you that you need to drink plenty of fluid, I'll get you a jug of water and leave it over here. So it's easy for you to keep on drinking. I'll also probably leave a few fruits over here so that you can eat some fruits. I'll leave you a call bell. So in case if you need anything or if you require any assistance, you can call us and someone will come to help you out. Fine, then is there anything else that I can do for you before I leave? And the patient will say no. Then you can say that, okay, I'll take away all my things. I'll make sure that they are clean and ready to use next time. And I'll do my fine hand hygiene and move the curtains. Yeah, okay, then I'll take your leave then.
Okay.
Fine. So
Okay,
you need to make sure that you are going to tell the patient that you have done what you were supposed to do, that you are now going to put it in the records, or you are going to update the notes of the patient. You are going to do a few things, like, as I said, that, okay, if you have given an advice to drink plenty of fluids, you can leave water. If you have given advice to eat, then you can leave something to eat. Please do not do that for patient who is nil by mouth. Okay, so don't get in that habit. Think that what you have to do. You can ask the patient if there is something that they would like you to do before you leave. Check whether they are comfortable. Leave a call bell with them just in case if they need to get any assistance. Yeah, and then you can do make sure that you are taking away all your articles back. If it is a skill that you are doing, you are going to say that I will be discarding the things appropriately in the clinical waste. If it is the API that you are doing, you are going to make sure that you clean all your articles and make them ready for the next use. And then you are going to do your final hand hygiene and leave the patient. Okay. So these are, remember that like the introductory 6, it is also equally important that you close the station in an appropriate manner as well. Okay, so 3 things are very important, 3 or 4 things you can take. Update in the notes. Yeah, making sure that the instruments you take back and clean and make them ready for the next time. Make sure patient is comfortable, and the call bell, and your final hand hygiene. 5 things. So remember to do them when you are closing any station. Okay, and get in a habit of saying these things, because sometime you might have to say all these things very quickly, especially if you're running out of time and you see that you have got just last 10-12 seconds to close the station. So you must get in a habit of saying these things so that you can quickly tell all the things and do the closure of the station. Fine, but otherwise, Agu, well done. So it was all, otherwise it was good, except that you need to make sure that it is a community scenario. So patient will not have a wristband. You should have checked that it is the patient's GP that you could have checked. Yeah, so that was one of the things. And in the community scenario, you will not require to take oxygen saturations. So you don't need to do that one.
Okay, ma'am.
Okay, these were the only 2 things, but otherwise well done for that.
Thank you.
Fine, guys. So I think that completes our assessment sort of thing. So do anyone have any questions in assessment? Okay, that's fine. I take it that there are no questions. Fine then.